Good morning, good afternoon, dear presenters and participants who are with us today. This seminar is a collaboration between the Office of Minority Health Research Center and the National Diabetes Education Program. The program, in conjunction with the Department of Health and Human Services, Centers for Disease Control and Prevention, and the National Institutes of Health, presents this seminar entitled The Important Role of Faith-Based Organizations in Fighting Diabetes. Experts from CDC and Sheila Sternberg-Smith will be with us, a navigator, Congressional Health Network north of the Methodist Lee Burger Healthcare, will be showcasing these experiences working with faith-based organizations and the NDEP and CDC Faith-Based Toolkit. Next slide. The HHS, Office of Minority Health, was established in 1986. Its mission to improve the health of racial and ethnic minority populations through the development of health policies and programs that will help eliminate health disparities. Known as OMH, was established by the Human Health Services in 86 and under the section of Pursuant to Public Health Services Act. As mentioned before, this is a collaboration of both entities or organizations. Next slide, please. The Office of Minority Health Research Center functions under OMH, HHS. The Office of Minority Health Minority Health Research Center was established in 1986 by the new Office of Minority Health in HHS as one of its initial efforts to respond to recommendations of the report of the Secretary Task Force on Black and Minority Health. First authorized by statute in 1990, it was most recently reorganized along with the OMH by the Patient Protection and Affordable Care Act of 2010. OMHRC is one-stop source for minority health literature, research, and referrals for consumers, community organizations, and health professionals. Next slide, please. This is capacity building is one of the resources provided by the Office of Minority Health Research Center, and this is relevant for the professionals and institutions working with minority populations across the U.S. We provide all of these services listed here for free to all institutions. So please do feel free to reach out to us, and we'll be happy to accommodate any of these resources to the needs of your institutions. Next slide, please. Now, for today, the Diabetes Prevention and Management Tools for Congregations. The objectives for today's webinar are: explain the important role faith communities play in addressing diabetes, describe effective approaches for faith community involvement in supporting people with diabetes and people at risk for type 2 diabetes, and identify resources to support diabetes activities in faith communities. Now, I would like to introduce briefly our speakers for today. Next slide, please. With us, we'll have Sheila Sternberg-Smith. She is a navigator of the Congressional Health Network at Methodist North Hospital. She works closely with area congregations on health education, health lifestyles, and clergy wellness. She previously coordinated the Not Even One Crime Prevention Program. Additionally, she holds certification as a National Ministerial Assessment Specialist. She is active in various community organizations, involving diabetes, cancer, and health disparities. She's a cum laude graduate of Memphis Theological Seminary with a Master in Divinity. In March of 2009, Ms. Sheila was commissioned as a Stephen minister at her church. She's a specialized study of congregational care ministry that required 50 hours of study. She was ordained in 2010 by Reverend Dr. Frank Thomas in Disciplines of Christ in Tennessee. We have Ms. Alexis Williams. She is a public health advisor for the National Diabetes Education Program at the Centers for Disease Control and Prevention. The focus of her work is developing and delivering training and technical assistance for NDEP programs and resources. In this capacity, she works with CDC-funded programs, partners, and community-based organizations to help strengthen their capacity to deliver effective diabetes prevention and control programs. And we also will have the pleasure to have with us Betsy Rodriguez. She's a diabetes educator and health disparity supporter for health and well-being of racial and ethnic minorities and vulnerable populations in the United States and Latin America. She works as a bicultural specialist in health communication strategies and development of diabetes educational resources for Hispanic, Latinos, and other minority groups. For the past 15 years, Ms. Rodriguez has been diligently working to support U.S. Hispanic Latinos that experience some inequity due to diabetes. She has developed multiple diabetes educational resources, culturally and linguistically appropriate for these populations. She conducts trainings to professionals and community health workers or promotores across North, Central, and South America and the Caribbean. Ms. Rodriguez was one of the principal investigators of the 10 years CDC-funded research conducted with the Pan American Health Organization, World Health Organization, U.S.-Mexico Borders, Diabetes Prevention and Control Project. With us, we'll have as the first speaker, Ms. Rodriguez. But first, I would like to have a poll question for our participants. Please do participate, and we will give you 30 seconds to answer, and when we will begin providing the answer. So the question: people with diabetes need regular medical care, regular physical activity, social and emotional support, or all of the above? Please provide the answer. So here we have your responses. Now, all of the above, 99% of you have participated in answering this question. Now, Betsy, could you share with the audience and expand on what are the needs of people with diabetes? Next slide, please.
Thank you, Diana, thank you, Alexis, and thank you, Ms. Sheila. Thank you for the Office of Minority Health for doing this webinar in partnership, and it's a great pleasure to be here with you all. Let me say first, buenos días or buenas tardes, good morning or good afternoon. It all depends in what area of the United States you are right now. So we're very pleased to have you all in our webinar today. So allow me to talk to you about why we paid a lot of attention to diabetes and why we think that faith-based community organizations have a role to play in fighting the burden of diabetes in the United States. So allow me to share with you an overview of diabetes in the United States. Next slide, please. We just released the new National Diabetes Statistic Report, which is a periodic publication of the Center for Disease Control and Prevention. And these reports provide updated statistics about diabetes in the United States. It includes information on prevalence and incidence of diabetes, prediabetes, risk factor for complications, acute and long-term complications, death, and costs related with diabetes. The data can help us focus our efforts to prevent and control diabetes across the United States. So if you go to our website, www.cdc.gov/diabetes, in the website slider, you have a direct link to the National Diabetes Statistics Report 2017 that has been just released. This report shows an estimated number of 30.3 million people of all ages, or 9.4 people of the U.S. population who have diabetes in 2015. This total includes 30 million adults aged 12 years or older. That means 12.2 of all of U.S. adults, of which 7.2 points were not aware or did not report having diabetes. The percentage of adults with diabetes increased with age, reaching a high of 25% among those aged 65 years or older. And compared to non-Hispanic whites, the age-adjusted prevalence of diagnosed and undiagnosed diabetes was higher among Asian, non-Hispanic Black, and Hispanic during 2011 and 2014. As you can see, diabetes is a high public health trend or problem. Overall, the prevalence was higher among American Indians, Alaska Natives, non-Hispanic Black, people of Hispanic ethnicity than among non-Hispanic whites and Asians. And if we want to deep down even more, among people of Hispanic ethnicity, Mexican has the highest prevalence, 13.8%, followed by Puerto Ricans, 12%, Cubans, 9%, and Central and South American, 8.5%. Diabetes is a serious public health issue. Next slide. The total direct and indirect estimated cost of diagnosis diabetes in the United States in 2012 was $245 billion. The average of medical expenditures for people with diagnosed diabetes was about $13,000 per year, and about $7,900 of this amount was attributed to diabetes. After adjusting for age group and sex, the average of medical expenditures among people with diagnosed diabetes was about 2.3 times higher than expenditure for people with diabetes. Next slide. So as you can see, diabetes is serious. As you can see here in the slide, we have an iceberg. And in the tip of the iceberg, we see that we have 30.3 million people with diabetes, as I shared with you before. However, we have to pay attention about the lower part of the iceberg, because right now we have 80.1 million people that have prediabetes in 2015 based on their fasting glucose or A1C level. Nearly half, or 48.3% of adults aged 65 or older have prediabetes. Age-adjusted data for 2011 and 2014 indicated that more men than women have prediabetes. Prevalence of prediabetes was similar among racial and ethnic groups. So we have an issue with people who have diabetes, but we also have those that may have it and they don't know it. And on top of that, we have people with prediabetes. In other words, people that can, prediabetes is the pathway to type 2 diabetes. Next slide, please. Prediabetes is a condition where blood sugar levels are higher than normal, but not high enough for diabetes, and increases the risk for diabetes-related complications such as heart diseases and stroke. Next slide, please. So what are the good news? The good news is that people with diabetes can lower the risk for complications through diabetes education, through regular checkups, and through an ongoing support for diabetes self-management. Next slide. We also have good news for those that have prediabetes. You can prevent type 2 diabetes. People with prediabetes have a higher than normal blood glucose level, but not high enough yet to be diagnosed with type 2 diabetes. As I said before, 84 million American adults have prediabetes, and nearly 90% of them don't even know they have it. A person who has prediabetes is on the path to developing type 2 diabetes, and it's an increased risk for additional serious health problems such as stroke, heart attack, blindness, and amputations. The good news is that prediabetes can be reversed through lifestyle changes like weight loss, healthy eating, and increased physical activity. The sooner a person is diagnosed and make lifestyle changes, the more likely they will be able to reverse prediabetes and prevent or delay the onset of type 2 diabetes. What are the steps that people with prediabetes can take to reverse the condition and prevent or delay type 2? The important thing to remember is that for most people, there's still time to turn things around. The CDC-led National Diabetes Prevention Program helps people with prediabetes prevent or delay the development of type 2 diabetes. It is a scientifically proven program designed to teach people practical, real changes that can help reverse prediabetes. By participating in one of the CDC-recognized programs, people can cut the risk of developing type 2 diabetes by as much as 58%, and 71% in people 60 years and older. There are hundreds of programs in local communities across the country that people can attend in person or even virtually. People can find local programs through the campaign website, doihaveprediabetes.org. Next slide. So I'm here now, Diana.
Yes, thank you, Betsy. And now we have our second poll question. True or false? Prediabetes is a medical condition where your blood sugar is higher than normal, but not high enough to be diagnosed with type 2 diabetes. True or false? We will provide 30 seconds for you to find your answer. Provide your answer. In just a few seconds, we will show your participation through the poll question. Thank you. And true. True is the answer. Yes. Prediabetes is a condition where blood sugar levels are higher than normal, but not high enough for diabetes, and increases the risk for diabetes-related complications such as heart disease and stroke. Thank you for your participation. And now, Alexis Williams will be our next panelist. Alexis, could you help us understand the important role of faith-based organizations in fighting diabetes? Where do faith communities fit?
Hi, well, good morning, everyone. Thank you for joining us for the presentation today. So, the question is, where do faith communities fit? Next slide, please. I think that traditionally when we think about a person with diabetes or pre-diabetes, we think about this as being a problem that's between that person and his or her healthcare provider. Next slide, please. But as Betsy mentioned, that a person who has diabetes or a person who has pre-diabetes has to make a lot of lifestyle changes, including making healthy food choices, being more active, maintaining a healthy weight, monitoring their health, taking medication, getting regular checkups, and managing the problems and stress. And so what I always think about is how many of these things actually take place in the doctor's office? Not a lot of them. Most of them take place out in the community, and when a person has troubles managing any one of these things, be it making healthy food choices or getting more active or having enough time to do the things you're supposed to do to take care of your health, those are things that take place every day out in the world that people live in. Next slide. people with diabetes and prediabetes and their families, because this is not a condition that just affects the person with the diagnosis. It also affects the entire family because they have to make changes possibly. They have to worry about their loved ones. They have to worry about their own health. We know that people who have family members with diabetes are at a higher risk for diabetes themselves. So it doesn't just impact the person with diabetes, it impacts the whole family. So that person and their family need social and emotional support. They need access to healthy food and activity choices. They need meaningful information and education. That is information and education that not only they can trust, but that they can understand. That's presented in a way that makes sense to them. And they need access to health care. Next slide. So when you think about it this way, it's not just between the person with diabetes and the healthcare provider. It's the person with diabetes, their family, and their community, their faith community, the civic and social organizations they belong to, their work site, their school, and their health care provider. We all have a stake in helping people with diabetes and helping prediabetes and their families. Next slide. So faith communities can play an important role in making a difference. We think about 3 ways in particular where faith communities are well positioned to help people with diabetes, help their family, and help people with prediabetes and their families. One is spreading the word about diabetes and diabetes prevention. As Betsy mentioned, many people with diabetes don't know that they have it. Many people with prediabetes don't know they have it. Most people with prediabetes don't know they have it. There are a lot of myths and misconceptions. There are a lot of just wrong things that people believe. People have a sense of doom about diabetes. They don't know the good news that you can manage diabetes and that you can prevent type 2 diabetes. And I think that faith communities have a really important role in spreading the word and providing people with accurate information to help them take charge of their health. Faith communities can also organize education and support activities, and they can help create healthy environments where making healthy choices is the easy choice. Next slide. So let's talk about each one of these. Spreading the word about diabetes. So as Betsy mentioned, most people don't know they have, with prediabetes, don't know they have it. People with diabetes don't know they have it. It's important for us to raise awareness. What is diabetes? What are the risk factors? How do you find out if you have diabetes or prediabetes? And just as important as being aware of diabetes is being aware of the steps that you can take to manage diabetes and manage prediabetes. It's not the sort of fatalistic attitude that some people have about diabetes, that there's so much of it in my family and there's nothing you can do about it and it has so many complications. We really want people to start to have a positive attitude that by making these lifestyle changes, they can have a healthy life. And it's really important for them to hear that in multiple places because it's true. We've come so far in learning how to manage diabetes and how to prevent diabetes that people need to hear that good news so they know that there are steps that they can take to control their health. So dispelling myths is really important. There's a lot of information. People need information from a credible place, and the faith communities are a trusted source of information, and so providing that credible information is one of the important things that faith communities can do. They can provide links to CDC-recognized diabetes prevention programs. They're out there in the community. Let people know where they can go and get help, and provide links to recognized or accredited diabetes self-management programs. Again, let people know where they can go and get help if they need it. And we're also starting to see these programs actually come into the faith community. So faith communities partnering with healthcare systems to come into the community and provide these resources in a place where people can access them. Next slide. So we also talked about organizing education and support activities. And one of the most simple ways to do that is to provide educational programs that motivate people to make healthy food choices and be more active. So many faith communities have things that are like health ministries or other kinds of health programming that encourage people to make healthy food choices, be active, maintain a healthy weight, manage stress, all of those things that are important to maintaining a healthy lifestyle. And having those in the faith community makes it easier for many people to access. And it also, I talked about earlier that the information has to be meaningful. And I think that faith communities are very good at putting this kind of information, these kind of behavior change information, in ways that are meaningful to people, in ways that healthcare providers can't necessarily do, because you tap into things that are important to people and that are meaningful to people, and people are motivated by their faith and their family, and the faith community is very good at helping people see the link between maintaining a healthy lifestyle and living out their core values. Another way that faith communities support people with diabetes and prediabetes is providing that emotional support they need. It's challenging to have to manage these conditions day in and day out, and so people need to learn to solve problems and manage stress, and they need a source of support and comfort and motivation, and you all know that that's the best place to get that for many people is their faith community. Caregivers need support. So they're not only trying to help your family member, but you may have other things going on with your own health as well, and it can become very stressful to be providing care for someone who's ill and take care of your own health. And so I think faith communities have a big role to play in supporting caregivers and also providing that support for behavior change. It's not easy to make these changes. You need someone who's going to be there for you, someone who's going to help you make good choices. It's okay when you slip up, help you solve problems, get back on the right track, and provide the kinds of social support you need, like walking clubs and educational groups and other groups like that motivate you to engage in those healthy behaviors. Next slide. And so finally, we talked about creating healthy environments. I used to work for a program that delivered healthy eating for cancer prevention through faith communities. And I worked with a lot of pastors and ministers and health ministers. And one of my coordinators had made a big change in her church's policy regarding the food that was served at large events. So whenever they would have a funeral, the church would provide this meal after the funeral. And they completely overhauled the meal after the funeral so that it would be healthy. And she said, we are not going to come back from burying our members and serve them the same food that put them in the ground. And I thought, wow, that is a powerful way to look at the kind of service that you're providing. So increased access to healthy foods and drinks, and many faith communities are looking at sort of the policies or the procedures they do around things like potlucks and picnics and food served to kids and after-school programs, and just making sure there are healthy options. It doesn't mean that you never serve pies and cakes and all those sorts of things, but that you also have options for people who want to make a healthy choice, that you have water and fruit and salad, so that people who are choosing to eat healthy, it's easy for them. I had another church that I worked with that had breakfast between the services, and they started to offer healthier options at the breakfast, and they started seeing people show up at the breakfast that they hadn't seen in a while, and the people said, well, I have high blood pressure, or I have diabetes, or I have this condition, and I couldn't eat the breakfast you were serving before. And since you changed, now I am able to come and eat this breakfast. So it really is a service when you start to make these kinds of changes. We also have faith communities that are looking at how they can increase access to physical activity resources. So they have walking groups, they have walking clubs, They do activities for seniors that help seniors be active. There's chair exercises that they do for people who have limitations in their mobility. We see churches do what's called shared use agreements, where they have an agreement either with another community-based organization or a school or some other group to make their grounds and their facilities available for people in the community to come and be active or garden or do some other type of physical activity in a place that's safe. I know in some communities, part of the problem with being active is that there are no sidewalks or people don't feel safe being out walking around. And so the faith communities are partnering with other organizations to provide a safe space for people to be active and be comfortable being active. You know, not all of us want to go to like a gym or can afford to go to a workout facility, and many people don't feel comfortable in those facilities. It's frankly, I think, more fun to be with your church members and doing something active that everyone can participate in. Okay. Next slide. So we have another poll question?
Yes, we do. And before we answer our question, the next poll question, I would like to thank you, Alexis, first for your intervention and for those fantastic recommendations, practical activities that can be implemented at the church. We would like to remind, and my apologies for not having mentioned this before, remind our audience for today that you can write your questions in the question box, and we will answer all questions at the end of all speakers' presentation. So our next poll question: which of the following is an example of how faith communities can spread the word about diabetes? A, create a healthy food policy for meals served at faith communities. B, create a library or diabetes resources. C, hold a support group for people with diabetes and their family members. Or D, all of the above. Please take 30 seconds to provide your answer, and we will share all answers at the end. And here we are, all of the above. Thank you. Yes, indeed. All of the above are different ways in which community-based faith communities can spread the word about diabetes. Thank you very much for your participation. And now we will have Ms. Alexis Williams again, her intervention as Reverend. The Reverend is not present at this moment. So, Alexis, please take it away.
Okay, thank you. So how do you get started? And like I said, I worked in churches for a long time, and the one thing I always said is you already know how to reach people, and you already know how to get people to come back week after week after week. You know, one of the biggest problems we deal with in health education, I'm a health educator, is people dropping out of programs and not coming back. So I wish we had the same return rate in our health education programs as faith communities have, because you know how to reach the people. So it's about applying the health education, bringing that health information into that area and doing what you already know in terms of reaching people, motivating people, keeping people interested, and helping people make healthier decisions. So the first step to getting started is to learn more about diabetes. And we have a number of resources at CDC and at the National Diabetes Education Program to help you learn about diabetes. Learn about the impact of the condition and learn about the impact of the condition in your community. You can actually go to our website, and the information will be at the end, and look at the statistics for your community. We have a online training for community-based organization called Developing Community-Based Programs for People with Diabetes. That's focused on supporting people who have type 2 or have type 2 diabetes. We also have a webinar on our website called Partners in Health. That's about engaging faith communities in diabetes prevention and control. And we have the Diabetes Toolkit that I'm going to talk about in just a minute. So learn about diabetes in your community, and engage with partners and communities. You don't have to do this alone. There are other organizations in your community who are trying to address this issue. There are diabetes prevention programs for people who have prediabetes. Your local healthcare providers have diabetes programs, both for people who have diabetes and people who have prediabetes. There are other community-based organizations, local and state health departments. So find out who else in your community is addressing this issue and look for ways to partner with them. Also look at what you are already doing. So you may already have programs in your faith community that are encouraging people to eat healthy or be active or manage their stress or in some way make some kind of lifestyle change or look at ways to make healthier choices. And you can put diabetes as a part of those programs that you already have going on in your community. Next slide. So the Faith Leaders Toolkit is a resource that we developed that will help you do the three things that I talked about in the last section. And this is basically it's a booklet, and it lists a number of resources that will help you spread the word about diabetes, develop education and support programs, and create healthy environments. And it has links to resources that will help you do all of these things. It's not going to help you sort of plan. It's not a step-by-step guide to doing an intervention. Like I said, we think that in many ways people already know how to do interventions, know how to reach people. This is for if you're looking for resources for your library, if you're looking for messages for your bulletin, if you're looking for, I'd like to start a support group. This will guide you to resources that already exist to help you do those things. Next slide. And we also wanted to let you know that the toolkit is now available in Spanish. Next slide. So the toolkit resources include print resources. So there are booklets that you can put in the library. There are handouts. There are flyers. There are posters that you can put up. So those are our print resources. They're all in the public domain, so there's no cost for you to print them out on your own, or some of them you can order from us, and there's no charge for you to order those from us. There are also digital resources in addition to the things that you can print out, that if you have a social media presence and you do things like Pinterest or Facebook or Twitter, there are messages, digital messages that you can use for those platforms as well. We have training. I mentioned the training for community-based organizations for people who have diabetes. We also have a webinar on our website. And then we have program guides. So New Beginnings guide you see there, that's a guide for developing a support program for people with diabetes and their families. We also have a program, a Road to Health Toolkit that shows you how to put together a program for people who have prediabetes. Next slide. And as I mentioned there, all of our resources are available in multiple languages. You can download them, you can order some of them, and there's no charge for any of those resources. So when you come to our website, there's the link we're showing you for the toolkit, the Faith Leaders Toolkit. You can download this toolkit and you can share it with other people, share it with your leadership, share it with other faith communities you might work with. and it's available in English and Spanish, and you can either share the electronic version, or again, this is a thing that you are free to print and provide to other people and use yourself. Next slide. So here's our contact information. If you have any questions, I think at this point we are ready to open it up for questions and discussion. We wanted to leave lots of time for your questions. And if you have any ideas about how you might address diabetes in your community, we'd like to hear those too.
Thank you very much, Alexis and Betsy, for sharing your insights and details about the Faith-Based Diabetes Program and Toolkit. Now, thank you to the audience as well for all your participation through the poll questions and all the questions we have received from you. We will, I have a long list of questions, and we'll provide them, send them to Betsy and Alexis to respond. Betsy, I think this question, or for both of you, Alexis or Betsy. The first question is, what is the definition of higher than normal prediabetes?
Higher than normal of prediabetes sounds like prediabetes, and as I said before, prediabetes is when the person has I'm sorry, bear with me for a second. I'm putting my notes here together. So a person has diabetes when her blood sugar is 126 in fasting mode. That lab should be repeated. But if the lab it's in between, because the other landmark is 200 at any given time as random, more than 200. So whatever is in between those two numbers, that is called prediabetes. That's what I was saying, that prediabetes is a condition where the blood sugars level are higher than normal, because you are not way too close to 100, you are close to 126 and you are close to 200, but you are not reaching those two levels in order to be diagnosed with diabetes.
Thank you, Betsy. The next question for Alexis or Betsy. I am a faith community nurse with an adult congregation of about 600. I held a support group and 8 people showed up. It only lasted 8 weeks. Is that about right? Should I try to do another group? It was kind of discouraging.
Well, I think 8 people showing up for 8 weeks, I think you said, that's fantastic. I think it's really difficult to get people, especially adults, to show up for a support group. And, you know, people have a lot of stigma about support groups, especially when you work with certain populations. I know men and African Americans and some Hispanic Latino populations are not comfortable with the idea of a support group. We have a program for people with diabetes called New Beginnings, and we call it a discussion group. And it's focused on just helping you live better, helping you and your family live better with diabetes. So we don't necessarily call it a support group just because of that stigma that's attached to, you know, if there's something wrong with me. But this is a discussion group where you learn skills like managing stress and problem solving and things like that, so that people don't feel that stigma that's attached to it. So I would say, first, it's great that you got such turnout. Talk to the people about why they can't, what motivated them to come. I'll definitely have it again because things change. You know, diabetes is something that people live with their whole lives, and things change over time. So you need to probably think about offering it more than once, because another round of people might come. Think about those initial people talking to other people about how great it was for them and how helpful it was for them. And look at the group and whether it's meeting the needs of the people that you are trying to reach. So are you talking about the things that are important to them? And do they know that those are the things that they're going to talk about? So when you promote your support group or your discussion group, do they know it's going to address things like how do I talk to my doctor and how do I manage stress? So make sure that people know what's actually going to go on in the group to make them feel more comfortable coming to the group. So
I would like.
Yeah.
I'm sorry. I would like to add some other thoughts. I have been married with a pastor for 40 years right now. So I have been always in charge of the health ministry of all the churches that my husband has been. And one of my lessons learned is, number one, as Alexis says, I never call them support group or classes or whatever. For instance, in the Latino community, which is where I work the most, we call it convivios. And convivios is a word to say that you're having like a get-together or something like that. So since we're always having convivios or the get-together meetings, which is usually on Wednesday when we have the Bible study, that usually happens before or after the Bible studies. So what we do is we put those kind of activities during those times, because that's a time when people are going to come to the church anyway, for those that attended the Bible studies, and it's part of the activities they are already doing, and within there, the knowledge, the skills, and the behavior change activities we're going to be doing are going to be around food, around physical activity. We have the speaker of the day. We have Ask the Expert. There are many, many, many activities, games and stuff like that. So you make it interactive. You make it part of the daily activities of the church. It's not yet another day that I have to, get in my car and drive over there. And that seems to be working for most of the group that I have been dealing with. The other thing is it's complemented with other things. I usually have a section in the church newsletter when we are promoting the activities in our convivio, in our get-together. And those things are strategies that I have been using over the years that seems to work.
Thank you very much to both of you for that complete answer. The next question, and this may be a question for you, Betsy. Are you using community health workers, promotores de salud, to teach diabetes prevention classes?
Yes, indeed. And my community health workers are people who began as part of my groups, and then I have been training them to be our coaches. And they are the ones that are actually doing all the knowledge part and the activities and all of that, because they're very good in our convivios doing the engagement activities, for lack of a better word to describe them. There are, the icebreakers and all of the different activities where they incorporated the knowledge and the skill people need to know in order to do behavior change. All of those has been guided by the CHW of Community Health Workers and Promotores. The other thing that the other aspect that I would like to add is that they're very good marketing our convivios. So and they're in the community, so they're inviting people, and that's how we have been able to increase the number of our people who are coming to our convivios through the marketing efforts of our promotoras.
Thank you very much for that answer, Betsy. The following question: do you partner with other community-based community partners to teach healthy lifestyle changes? Local food banks provide classes for children as well as adults.
Yes. In our experience, we use a lot Boy Scouts and Girl Scouts, because behind those kids are mothers and fathers. So we join forces with those, and that seems to be a way to recruit people come to our convivios. Alexi, you have anything else to share here?
Yeah, I would say yes. We encourage those kinds of partnerships, and we look at ways to do those kinds of partnerships. I think if you go to our the webinar that I mentioned about the Partners in Health, that talks about the partnerships with community-based organizations. And then we also have another webinar on our website that talks about food insecurity and how food banks are getting involved in helping people with diabetes that come and use the services of the food banks. So I think that's also another good partnership between faith communities and food banks, and looking at ways to make the pantry or the service more helpful for people who have diabetes, heart disease, those kinds of conditions. And then if you go into the toolkit, the Faith Leaders Toolkit, the third section about environmental change has some information about shared use agreements and how you can partner with Parks and Rec, schools, and other community-based organizations around issues on physical activity, neighborhood safety, those kinds of issues. So, yes, partnerships are encouraged. And frankly, my opinion is this is only going to turn around by the use of partnerships. So we all have to work together.
Thank you.
Yeah, I also have found that the Lions Club and the Rotary, and also the small and big bodegas, has been a great partner for us. From the bodegas, it's we even have a program where the people that goes to the bodegas bring back the receipt of their expenses, and that is the way on how we get the funds to keep the health ministry alive, because then the bodegas give us some percentage of the total amount that has been spent with the member of the church, and that's how the funding to sustain the program that we have in our churches comes from the bodegas, the small ones and the biggest ones. So we have a whole package how to become a champion for the program, and this is one of the ways we have been working with bodegas in order to get funding to sustain the program.
Thank you again to both of you. And here is to the audience. I know we have a whole lot of questions. We may not be able to provide an answer to those questions, but we will provide address your questions as we when we send the recording of the webinar. So here is the next question. Are there any published studies or articles about faith-based communities who have implemented any of the diabetes efforts discussed in this presentation? And how can we access the toolkit that you mentioned and other resources that were shared during the webinar?
Well, you can come to our website, which is listed right now in the slides, www.cdc.gov/diabetes/NDP. You can search by toolkits, or you can put in the search area faith-based toolkit, and in either way, you will get the faith-based toolkit that was developed by us. In terms of studies supporting our resources, these resources are pretty new, so we don't have any studies of measuring impact or anything like that. We tested when we developed this, but there are plenty of many other publications that are related with the effectiveness of faith-based activities. And Alexis, can you expand a little bit on this one?
Yeah, these particular resources are not published, but they're based on other interventions that were tested. So if you do if you use PubMed or something like that, then you can find there were a number of 5-a-day trials in the health with faith communities, Body and Soul. I'm trying to think of the other ones off the top of my head. But if you do a search for, there are some in diabetes, the Diabetes Association, I'm blanking on the names of all of the interventions now. but the way that we came up with these three strategies, the awareness, education, and support, that's based on what the evidence says work in faith community interventions. So not just around diabetes, but heart disease and other chronic illnesses that are addressed through faith community. So I would recommend just doing, a PubMed search or a Google Scholar search, or however you search for publish the literature, and you'll find a number of interventions, and that's where we base these recommendations on.
Thank you to both of you. And now, two questions that complement each other. One is, the problem in my congregation is not reaching out to people, but rather to having a long-lasting impact with groceries, providing and maintaining healthy choices as the first choice of purchase. And the other side of that question is, by another participant, how to reach out to the congregation members who may not have diabetes at this moment, but the diabetes is in their peripheral, how to engage with them.
There are many ways that you can do this. I'm going to share the one that I'm using the most. I have some surveys that have been used by other faith-based organizations. And with that survey, what I'm finding is health concerns in the congregation. And based on the health concerns in the congregation that the members of the church are telling me, I go ahead and develop the interventions. So that's one way. The other way is not to call it people with prediabetes, but rather healthy lifestyle, and then incorporating that in all of the church activities. It's not a program per se, because at the right moment that you call them program, the things that come to their mind is, oh, I have to go to a class or something like that. So you have to make it that it's part of the daily activities of the church, and it has to be reflected in every single aspect. For instance, when churches have those special big huge dinners, so we have to pay special attention that we're doing what we're preaching, and has to be healthy menus. So it's a modeling kind of process. Alexis, do you want to share?
Well, I agree with that. It's something that starts with leadership, and it's not that people have to be perfect. It's that if you show that we're at least trying, this is important, and this aligns with what we believe as a community, then the people will think more about coming along with you. It provides further encouragement to them to think about changing their own behavior. And for those who are trying to change their behavior, it provides them with support to see that they're not in it on their own. Yeah.
Thank you.
And it has to be reflected in all the aspects of the church. For instance, the food banks. Many churches have food banks. So in the church that we're doing, that my husband and I were having, that we were managing right now, I'm in front of the food bank, and one of the things that I have been doing is teaching the people who is helping me keep the food bank together and making the packages is for donors. I have a list, so I'm not taking any more of those Maruchan soups, noodle soups, or things like that. So I have to say no to unhealthy stuff. If donations are going to come, it has to be healthy donations. So we will deliver to our families healthy meal packages. So as you can see, it has to be permeated through all the church activities, this healthy living lifestyle, because it's a way of honor the Lord.
Thank you very much again to our panelists and to the audience for the overwhelming amount of questions we have. all your questions will be forwarded to the presenter so that they may answer at a later time. And we do have all those who enter the webinar, we have your contact information, emails, and we can provide answers to your questions. Again, now we have reached the end of our hour. It's 12:02. Thank you very much. We want to respect your time. Again, thank you to our speakers, Betsy Rodriguez and Alexis Williams. Thank you, and we hope to see you again in another series of webinars for diabetes prevention of type 2.
And you can, if you had questions for Reverend Easterling, she was on, we just couldn't open her line. So if you have questions for her, you can include those too because she was listening. So we just couldn't get her line open. But she can answer your questions as well.
Thank you. We will have an evaluation that you will receive attached to the email that will go out with the recording of this webinar. It will also, the evaluation will appear at the end when you close this webinar. So please stay tuned, and we will appreciate the answer to the evaluation of the webinar so we can have your feedback to improve a series of webinars of this type. Thanks again for your presentation, the speakers, and for your attendance and time to the audience.